medial portion of the patient's ankle to test for the posttibial pulse. And then I would place my fingers on top of the, under the foot to test for the, no, on top, pardon me, on top of the patient's foot for the pedal pulse. And I want to note that all of these pulses are 2+, which is a normal pulse. Then I'm going to move on to my edema assessment. So while I'm down at the post-tibial pulse, I am noting if there's any edema. So the way we test for edema is we put our thumb and press it into the post-tibial area. This is the area that is easiest to find if there is edema, which is why we're testing here. And I would want to know if when I press my finger in, if the skin stays or if it retracts right away. This will indicate if there's edema or pitting occurring. Then I'm going to move on to my capillary assessment. So once again, I am going to press the patient's finger and ensure that the color returns in 1 to 2 seconds. That is a normal capillary refill. I can do this on the patient's fingers or their toes. Lastly, I'm going to do the temperature assessment. So I am going to rub the back of my hand over the patient's extremities and body to signify that the patient's body temperature is normal. Then I am going to move on to my neurovascular assessment, which is my last assessment of the cardiac assessment, and that includes my 5 Ps. So I am checking for pallor. How is the patient's body color? Is it tan and pink, or is there erythema throughout, redness? So I'm noting pallor. I'm noting the pulses. I just did that, so I'm noting that they're all 2+, or if there are any abnormalities outside of that 2+, I need to note that. I'm noting pain. When we're doing this, did the patient experience any sensations or pain while we were doing that? I'm noting paresthesia, which is numbness or tingling. So while I was performing my cardiac assessment, asking them to move their extremities, was there any numbness or tingling? And then paralysis is my last P, and this is movement. So was there any pain regarding movement? So that would complete my cardiac, peripheral, and neurovascular assessment. And then I would want to move on into my abdomen assessment.